CPR is a life-saving procedure and every doctor, regardless of your specialty, you need to know it. Aapka brain, the brain will not be able to survive. Sir, ma'am, if they do not respond, if they respond, you know they are conscious. If they do not respond, tap them on the chest. Sir, ma'am, do you hear me? Do you hear me? Now the force of compression should be directed vertically downwards. This is your force of compression directed. Can I comfortably do CPR for 30 to 45 minutes? Probably no. Why? Because after all, we are humans. We will get into fatigue. So guys, let me start with a story. So once I was traveling by air with one of my radiologist friend, and we were on the airport waiting for our flight, and we hear an announcement. Is there any doctor out here? Of course, being a medicine doctor, मेरा हाथ तो पहले ऊपर नहीं जाएगा. Radiologist को बताना पड़ता है कि I am a doctor. So he raised the hand, and he was escorted to a place where there was a collapsed patient on the floor. Now imagine a radiologist who has last touched a patient during his internship and a collapsed patient. He was sweating more than what I am sweating right now at the 50 degrees Celsius of Rajasthan. But don't worry, the patient got saved because हम थे वहाँ पे. So I was also called in, and when I went there, the patient was in a collapsed state and I had to initiate the CPR. CPR is a life-saving procedure and every doctor, regardless of your specialty, you need to know it. But the problem is not just knowing the right way of doing CPR. More important is to know when not to do CPR and when to do CPR. Because I can give you a list of doctors who have lost their medical license because they initiated CPR जहाँ पे CPR करना नहीं था. So now tell me, when should we do the CPR? To initiate CPR, there are two conditions required. First criteria is that the patient should be unresponsive. Second criteria is patient should not have pulse. When both the criteria are met, only then we are supposed to initiate CPR. If the patient is conscious, pulse is not felt, we are not supposed to start CPR. And if the patient is unconscious but pulse is felt, again we are not supposed to start CPR. Why are we doing CPR for a patient who is unconscious and pulseless? If you're thinking that you're stimulating the heart by pumping and you're making the heart wake up, you're absolutely wrong. ये सिर्फ फिल्मों में होता है when the loved one comes and touches and the patient wakes up. Reality, you don't have the magical hands. So why am I doing the CPR? The objective of CPR is to deliver the blood to the brain from the heart, because heart has stopped functioning for some reason. You might have to find out the reason and correct it, but by the time you correct the problem and heart starts functioning, आपका brain, the brain will not be able to survive. We will end up with a brain dead individual. So please remember, the objective of CPR is to keep the brain alive till we get sorted with what is wrong with the heart. So I hope you got the message clear. Two criteria should be met to initiate CPR. Number one, patient should be unresponsive. Number two, patient should have no pulse. Now let us see this patient whether needs CPR or not. Now how will I get to know whether patient is unresponsive or not? First thing is, call out the patient's name loudly. If you don't know, it's an unknown person, just call out sir or madam. Sir, ma'am, if they do not respond. If they respond, you know they are conscious. If they do not respond, tap them on the chest. Sir, ma'am, do you hear me? Do you hear me? Now, of course, this is a mannequin. I'm not getting a response. But if it was a real individual and I do not get the response, I know patient is unresponsive. Mera pehla criteria is met. What is the second criteria? Patient should have no pulse. Because if pulse is there, that means the brain will be perfused. So I don't have to worry about survival of the brain. But if there is no pulse, patient will be losing the brain. Now, how will I assess the pulse? Most of us will try to assess the pulse at the radial artery, which is not the reliable method. Why? Because the radial artery pulse can be easily missed when there is vasoconstriction, and in many conditions when there is a shock-like state, there will be peripheral vasoconstriction and radial artery pulse may not be well felt. So even when the cardiac function is good, you may misconsider it as absent pulse. So what is the ideal location for looking for the pulse? Ideal location will be carotid. So feel the patient's carotids. See whether you can feel it. If you are able to feel pulse is there, then there is no need for CPR. If you are not able to feel the carotid pulsation, then pulse is absent. Again, an important rule, when you are feeling for the carotid pulsation, feel only one side, not bilateral. If you try to feel the bilateral carotid pulsations, you can literally cut off the blood supply to brain. So what cardiac arrest could not have done, you can do to the patient. You can make the patient's brain lose the blood flow. So we are not supposed to do that. So now in this case, the patient did not respond to me. I could not feel the carotid pulsation. So this calls for CPR. So let's learn how to initiate the CPR. The scene is set. So let's start CPR. Rule number one, whenever you are doing the CPR, make sure that the patient is on a firm, safe surface. flat, firm surface. It can be the floor or the patient bed, but make sure it is flat and firm. Now, to make the CPR comfortable for you so that you can deliver an effective CPR, also adjust the patient's bed's height or get on the patient bed so that you are at comfort. So, like in this scenario, I am on the patient bed so that I am at comfort. Now, where should I compress, right? So, position your hands like this, and then your hands should be positioned on the lower half of the sternum on the midline. Once it is positioned, make sure that you lean sufficiently forward so that you are making a 90-degree angle. Your upper limb is making a 90-degree angle with the patient chest. Now, the force of compression should be directed vertically downwards. This is your force of compression directed. Now, from where or from which muscles I should generate the force of compression? It's not mainly from your triceps. यहाँ पे ये triceps push-up का exercise नहीं हो रहा है. The force of compression should come from your shoulder joint and upper chest muscles. So the force is directed vertically downwards from your upper body this way. This is the right way of delivering the chest compression. Now, how much deep I should compress? Should I go and touch the vertebral bones? Of course not. But to make the CPR effective, objective क्या है? Heart से blood को हमें brain की तरफ push करना है. So it will be only delivered to brain when my depth of compression is at least 5 centimeters. So you should compress 5 centimeters down. Once I have compressed, my compression should not offer any resistance for the recoil of the chest up. The chest should be recoiling freely. जैसे ही हमने 5 centimeter deep compress किया, I should relax my compression so that the chest recoils freely. Then again compress. Now, how many compressions I should do in 1 minute? To make sure that the brain stays alive, I give it sufficient oxygen. I have to compress at least 100, 120. So my compression rate should be 100 to 120 per minute. So it really calls for fast compressions and deep compressions. 5 centimeter depth and 100 to 120 compressions per minute. Now there comes a question. Why am I doing these compressions? To deliver the blood to brain. But why brain needs blood? Because blood takes the nutrients and even more important, the oxygen to the brain. By compressing, blood तो पहुंचा रहा हूं, this patient is unconscious, may not be breathing, तो oxygen कहां से आएगा? So I have to deliver oxygen as well. So I need to give breaths too. So then, when do I give breaths and how many breaths I should give? So what the BLS protocol says is, after every 30 compressions that I have done, I have to deliver 2 breaths. Now how do I deliver the 2 breaths? More safer alternative is to have an ambu bag and deliver the breaths to ambu. But if you don't have an ambu bag, like in this scenario, what should I do? You have to do mouth-to-mouth breathing. How do I do that? First, you yourself have to take deep breath. Once you've taken a deep breath, position the patient's airway safely so that you just do a small chin lift and then use your thumb to press the lower lip downwards. If you have an airway, position airway so that the tongue doesn't fall back. If you don't have an airway, at least get this position straight, and then you can put a cloth or something for the safety and then breathe into the patient's mouth. This is what mouth-to-mouth breathing stands for. But if you have an access for an ambu bag, it makes it safe for you so that you don't contract infections if the patient is going through a respiratory infection. Use the ambu bag. Deliver 2 breaths. Once the 2 breaths are delivered, you should get back to CPR, and again next 30 compressions, you should continue the CPR and the cycle will keep repeating. What is the cycle? 30 compressions followed by 2 breaths, followed by 30 compressions, followed by 2 breaths. How long to continue this? Till you reach 2 outcomes. One, patient shows signs of brain death, or patient shows signs of recovery. Otherwise, we are not giving up. Generally, if the CPR is effective, we will be able to keep the brain alive for 30 to 45 minutes with the CPR alone, with good quality breaths and good quality compressions. During this period, we should make an attempt to identify what was the reason for the patient to develop the cardiac arrest and solve that. There comes a big problem. Can I comfortably do CPR for 30 to 45 minutes? Probably no. Why? Because after all, we are humans. We will get into fatigue. So after 3-4 minutes, I may not be able to run this CPR effectively. Ya to I will slow down. I may not be able to get these 100 to 120 compressions per minute. Or if I am concentrating on the 100 to 120 compressions per minute, my depth of compression will come down. So my CPR quality will get compromised. जो brain को मैं alive रखना चाहता हूँ, I may not be able to keep it alive. So that's why after every 2 minutes, the CPR provider should change. So if you have another person to assist you, after 2 minutes, heroism nahi dikhana hai that I can do for 5 minutes, 10 minutes, half an hour. The truth is that the quality of CPR will go down with the time. So better is that after 2 minutes, hand over to the next person to do the CPR. He can do it for 2 minutes and then again you can take over. So we are learning 3 important points here for a good quality CPR. Number 1, the depth of compression should be 5 centimeters or 2 inches. The rate of compression should be 100 to 120 per minute. Breath to the compression ratio is 2 breaths for every 30 compression, or you can say 30:2 compression to breath ratio. And when do we rotate the CPR provider? After every 2 minutes, right? These are the golden rules for CPR. Once we initiate the CPR, we will stop the CPR if I start noticing the signs of brain death or signs of recovery. Now the question is, what is the signs of recovery? The signs of recovery, we will call it as ROSC. What ROSC stands for? Return of spontaneous circulation. What does that mean? If I can start feeling the pulse coming back, pulse is back now, I can feel it, then return of spontaneous circulation is there. So now I can stop CPR and then treat the underlying condition to make sure that he does not develop a cardiac arrest. When my friend is doing the compression, should I check the pulse? The answer is no. Why? Because when friend is compressing, he is generating a pulse, he is pushing the blood towards the brain. So if I try to feel the pulse at that time, I should feel the pulse, because if sufficient compression is not there, pulse will not be there. That means it's a poor quality CPR, right? So when do I feel the pulse? When one operator is handing over to the next operator for the CPR, that is the right time to check for the pulse. And under no circumstances, we are supposed to take a pause for the CPR. Now the question is, when should I check the pulse? क्या CPR को बीच में रोक के pulse check करना सही है? The answer is no. Why are we doing CPR? To keep the brain alive. Every break that you take during the CPR pushes the patient at risk of developing brain death. And of course, as a doctor, I don't want to see my patient being brain dead. So then how would I get to know whether the pulse is back or not? So please remember, when we are doing the compressions, of course the pulse should be there, because that's how the blood is going to brain. So there should be carotid pulse felt when doing the CPR. So I'm not checking it at that time. I get a window of opportunity to check the pulse when I'm rotating the CPR provider. So when I'm done with 2 minutes of my compression and when I'm handing it over to the next person, I can use this as a window of opportunity to check for the presence of pulse. If pulse is present, that means return of spontaneous circulation has happened, and then I can stop the CPR, try to identify the underlying cause and treat accordingly. So this is the basics of CPR, which is all based on what we call as basic life support protocol from American Heart Association. But this is not the best way to save a patient who is in the mouth of death. What is the best way? There is more advanced version of it called as advanced cardiac life support, where apart from an effective CPR and oxygenation, we also take care of other issues. We try to stimulate the heart with drugs like adrenaline, and at the same time we may consider using antiarrhythmic drugs, and we use defibrillators. So if you want to learn more about life-saving procedures like advanced cardiac life support, connect with us on the live class, and ACLS भी हम discuss करेंगे live class में.